Hi, I am Professor Dr. Meriç, member of IVF Turkey. I'd like to talk about causes of infertility today. Infertility is not getting a term pregnancy after having regular unprotected sex for a year in women under 35 and 6 months in women over 35. So the age of women is important to describe infertility. If she has been unable to get pregnant entire her life, it's so-called primary infertility. If she had a previous child, it's called secondary infertility. Infertility causes are related to male in 30% of cases, related to female in 20% of cases. Both are responsible of infertility in 20% of cases, and unfortunately, 20% of cases is described as unexplained infertility. That means we do not recognize or identify any specific cause of infertility after having tests, ultrasound, hormonal assessments. So it's called unexplained infertility, and almost 1/5 of infertile couples are suffering from unexplained infertility. Let's start talking about women. In women, ovulation disorders is the most common cause of infertility. The other problem is uterine abnormality, which includes anomaly of the uterus, uterine fibroids, and uterine septum. Uterine fibroids, if they are located inside the uterine cavity, may be the major cause of infertility. But fibroids located in the wall of the uterus or the outside the uterus may be a factor, but they cannot be blamed as the cause of infertility. The other problem is the tubal factor. Problem might be the obstruction of the tubes due to previous infections or congenital problems. So it's so-called tubal infertility. Hysterosapiogram, which shows the tubal patency, is the major test to assess tubal patency. The other problem is the hormonal abnormalities in women, mainly thyroid problem, hyperprolactinemia, and polycystic ovarian disease are the most common hormonal abnormalities causing infertility in women. Women with polycystic ovarian disease suffer from irregular ovulations that might impair them to get pregnant. Other problem, which is also common in women over 35, is the premature ovarian failure. Premature ovarian failure is described as ovaries stop working before the age of 40 years. If you are suspicious of having premature ovarian failure, irregular menses, or the changes in the amount of bleeding, you might go see your doctor to make sure of premature ovarian failure. Let's talk about men. Mainly, there are two problems in men: sperm production or hormonal disturbance of men. Sperm production may be impaired in the testes, or sperm production might be okay, might be adequate, but the canal carrying the sperm from the testes to the penis might be obstructed. It's so-called obstructed azoospermia, which might be the cause of infertility. Please do not delay to get pregnant for a long time. So I believe it's the best way to get pregnant between 25 to 35. After 35, there is a dramatic decrease in the quality and the number of eggs. Another one is smoking. Smoking significantly increases the risk of infertility in both men and women. Alcohol. High amount of alcohol use might be related to poor quality of sperm and egg. Being obese or overweight also can increase the risk of infertility. Please try to be in the optimum body mass index, which is between 20 to 25. And being overweight could significantly decrease your chance of getting pregnant. Don't forget that if you get pregnant, you'll put another 10 to 12 kilograms on the weight you presently are. Therefore, if you get pregnant with an excessive weight, pregnancy also will be very difficult. Exercise. If you do heavy exercise and vigorous exercise, and if you lose too much weight, this is another problem for your hormones to be disturbed. So please try to be in between an optimum body mass index interval. Another factor is the sexually transmitted disease. Therefore, if you are willing to have intercourse with somebody, please use condoms to prevent sexually transmitted disease. Sexually transmitted disease and bacteria or microorganisms placed in the cervical canal might go upwards and destroy your tubes and subsequently cause tubal factor infertility. We IVF Turkey team are willing to be with you in the treatment of infertility. Good luck!